Okay, so I think we can proceed with the session. Okay, I will brief you about the session and will then share the screen with all of you. So, guys, can you believe we have already reached the final session of our 6 day journey through the fascinating world of, the Theranostics? It's been a very intense, insightful ride, right? From understanding the very basic principle to exploring various, cancers, safety, dosimetry, and now we are ending on a high note, and that is nothing but the future. So today's session is all about the future concerns, right? What is emerging, what is existing, till date, what is existing, what is the timeline, how to challenge the future problems, what to do next, what is emerging. Everything will be the discussion part of the session. So let me tell you that today's session is all about, looking ahead. So we will explore some of the nanotheranostics as well. Now you will be surprised to know, like for us, theranostic is the new term, and here we have another term that is a nanotheranostics. Okay, so we will explore some of the principles of nanotheranostics, where the nanoparticles are, not just the smart, but they are doing multitasking from diagnosis to delivering therapy and even sometime monitoring response. So all in one go. So we will also touch on the power of artificial intelligence. Like from since the very first lecture on Tuesday, many people have question on this topic, like what is the role of AI, what is the role of AI, right? So we will discuss today, like it is written in the brochure itself, that it is a topic of the last session, that is artificial intelligence and machine learning, how it's reshaping the image analysis, treatment planning, and even helping us to personalize doses like the never before. So, and of course, we can't talk about the future without discussing some of the ongoing and upcoming clinical trials. So, that is the heart of the future, right? So, that will also the part of the discussion are also, we will discuss about the vision trial, obviously, NETT or the therapy. That is also the, we will, just a minute, it's just me or everyone are hearing echo from my, uh, is it any problem with my audio? Sure. Am I audible to you guys in clear voice? Okay, I think it is from your side, Mega, the problem is. Okay, thank you guys for your response. Okay, so what was I was talking? Okay, so I was talking about, of course, we can't talk about the future without discussing some of the ongoing and upcoming clinical trials that are again, paving the way forward. Whether it is vision, whether it is NETTER, or whether it is therapy. Therapy is again a trial we'll discuss in the slides, and many more are there. So these studies aren't just on the paper; they are redefining our care. Okay, and we will also step slightly outside the oncology box to see how theranostic is expanding to the areas like inflammation, infection, cardiovascular diseases, and some of the neuro diseases as well. So I think that was also your one of the session. I have seen that question, that what is the role of theranostic apart from oncology. So that is also the part of the discussion for today. And finally, we will be seeing the real challenges which are ahead of us, whether it is access, affordability, because cost is also the challenge, and the the step which is every step which we are taking for the moving forward. The challenges are there because innovation isn't just about what is possible, but what's practical and accessible to all. So the challenges are the major part to discuss. So, okay, let's jump in and dream a little bigger today, because the future of theranostics is not only happening, but it's our, our own to, it's on our own to shape it, right? So, I hope now that you know the concept clarity, because now we are moving forward with the future perspective. So, every principle what we have learned till date will be in a short form of today, right? So everything will be there in the slide, and we are proceeding with it. We again have some videos to see how nanoparticles delivery is happening, so do not worry. And it is not that hard to understand the future, right? So obviously we will take some question and answer in between and at the end of the session. Okay, so let's just start. I'm sharing my screen, just give me a minute. Okay, I think there is some mistake over here. It is a lecture number 6. Okay, I hope the screen is visible. We are back again with our course title, Theranostics, the future of personalized cancer treatment. But we are jumping and diving deep into the future word here, right? So let's just start. This is our module number 6, and the last it is the future innovations will see what is the role of nanotheranostics, what is the role of artificial intelligence, and what are the clinical trials emerging in it. These are the topics to discuss today. We will discuss about the nanoparticle based theranostic platforms, whatever we are having. We will discuss about AI and image analysis, treatment planning, and precision dosing. Like or from which kind of help you can go for the precision dosing itself. Also, the topic of discussion will be ongoing and future clinical trials, vision and NADTR. You already know phase 3 clinical trials it is. And also we have therapy. You can see here it is written as a thera and the P capital. Okay. So this is also a clinical trial comparing the 177 LU PSMA therapy, which is for the prostate cancer, with the traditional chemotherapy associated with the cabazitaxel. Okay, so cabazitaxel is a chemotherapeutic agent, and this is therapy is the clinical trial comparing our modern 177 LU PSMA therapy with the traditional conventional the cabazitaxel chemotherapy. Okay, in the man with the metastatic resistant form of prostate cancer, which is written as MCRPC. Okay, metastatic castration resistant prostate cancer. So who already had received previous treatment, and it shows a better response and fewer side effects associated with 177 LU PSMA. That is the result of it. But we'll see what is happening in the therapy as well. I assume that you already know what is vision and NADTER. I'm not going in detail because it is a fair, the main topics I think it is left behind. So I'm not going into detail about vision and NATTR. Since last two lectures, we have been discussing over these two topics. Also, the topic will be expanding theranostics to non-oncological areas. Maybe it is inflammation, infection, cardiovascular, neurovascular, right? And the last topic we'll discuss about the challenges, whether it is for access, affordability, which is a cost, of course, and training needs as well. Okay, so this is the very interesting. These are very interesting topic to discuss further in the field of theranostics. Let me just give you the disclaimer, guys, that if you are looking for future things now, you have to be very very broad minded with these things, because it may be there, may not be. And if the challenges are written here, but in practical aspect the whole challenge is very different on a level, right? So when we are discussing about future, we cannot say that everything is in a blur side, but we have a clarity, but we have to be very broad minded with these concepts. Okay, so maybe at any point it may change, the perspective may be changed, the results may change, right? So these are the things which are associated with the clinical trials as well. So whatever existed till date, those are the topics for the today's discussion. We obviously include what is coming next, but not in that detail that what is happening, because it is not concluded yet. Okay, so that is a small the disclaimer before proceeding. So obviously when we are discussing about future, what happens to us is many questions are in mind, many confusions are in the head, but everything aligned with our curiosity. Like if you are following a current affairs in the pharma, this theranostic is a very new and novel term, right? And I am really glad to introduce this course, because I think this is India's very first short course on the theranostic. As I searched about it, only we have a one course by from the Kochi, I think. They introduced the theranostic course, but for the 12 months, so a whole year, right? Short course, introductory course to for the pharma students, it is for the first time happening on the climate. So that is a very good initiative by us, and your interest also has been very good throughout the 6 sessions, so I am very glad about it. So that is the the things which are coming next to us, which is the theranostics. So let's just understand with the learning objective. So by the end of this session, you will be able to understand the concept and applications of nanoparticle based theranostic platforms. What has the importance of nanoparticle? As its name suggests, it is nano in size, very important for concise targeted therapy. we'll discuss about it. Also, you will be able to describe the role of AI in the image analysis, treatment planning, precision dosing. Also, you will be able to summarize some of the major key clinical trials, whether it is vision, NET, or therapy, and their impact on the theranostic practice, of course. Also, you will be able to recognize the potential of theranostics in the non-oncological areas such as inflammation, cardiovascular diseases, infection, neuro diseases as well. Also, you will be able to identify some of the major challenges the future has and some of the directions in future in the expanding this particular access, affordability, and training in the theranostics. So this is a very impactful learning objectives we are aiming for this session. Let's continue with the very first title, which is again in a green. Introduction to Future Innovation is the very first topic to discuss. I am just reminding you that what is theranostic. It is having a fusion of word therapy and diagnostics using the same or some of the linked molecular agents. So basically, same link is another name. Same agent is, for example, we have iodine, and link that is nothing but tagged with some other isotope, whether it is 177Lu dotatate, 68Ga dotatate, right? One is for imaging, one is for therapy. The same target, different isotope, same chemical moiety. Dotatate is same chemical moiety. Isotope is being different here. One is gallium, one is lutetium, right? So these are the things. Some of the same is also being used. Same component is being used for imaging and therapy as well. For example, iodine. I think these sentences are now being understood by you, right? So it allows personalized treatment by identifying disease, selecting suitable therapy, monitoring response forward, and adapting care all in one platform. That is the aim for this particular theranostics. So let's just see the evolution of theranostic, like from where it all has begun. So I already shared in the very first lecture the historical evolution of the particular term, right? But it is just a reminder again that in 1940 to 50 we have first milestone, first use of radionuclide, that is the iodine, for thyroid imaging and treatment, right? And the Hertz was the one who gave the idea of the this particular technique, that imaging imaging components can be also having the role of therapy as well in the future. In 1990 we have a conventional nuclear medicine. For example, in at that time we have a 99 mtc, which is a technetium 99. I think in one of our video which I have included in the ppt, that was talking about technetium 99. I have told you that it is having a very short, the half life, and it is also having a very big side effect profile. So it is being restricted at some point, but it is still in use, right? 99 mtc, technetium 99. Again, it is a radioactive isotope. I want you to remind. It is commonly used in the medical imaging techniques, and the M stands for, here you can see the M. Okay, so M is stand for metastable. Okay, meaning it gives off the gamma rays, as it decay. So basically M is for metastable. Okay, so it is being used for diagnostic separate therapy agent. It is from the 2000 we have a targeted radio ligand therapy, which is RLT, using this 177Lu dotatate for some neuroendocrine tumors. By 2010s we have theranostic becomes mainstream, but we don't have that name. Okay, so we don't had that name. Matched imaging was done in 2010, the 68J dotatate and therapy with the 177Lu. And by the 2020 and from the 2020 itself, we have a next generation innovations in this field, and that is nothing but a nanotheranostics. Apart from it, we have the AI integration into it, multi-omics. Now you know the multi-omics meanings, like it is including genomics, we have a omic data like genomics, then we have genomic, then we again have what, metabolomic, right? Proteomics. These are the terms we have in a multi-omics data, which is again driven for more personalized treatment. Genomic, we give you the idea about person's gene being responsible for what will be the therapy effect, what will be the drug response. Okay, proteomic will tell you about the protein mechanism and components. We have transcriptomics. Further, multi-omic data are there, AI integration is there, there, nano theranostic is there, all in one given, integration is happening, and the principle is very same, personalization, right? So this is the direction where we are moving forward since 2020. And this is a future focus area, like we are focused towards the precision. Molecular targeting ensures the therapy hits only the disease cell and not the healthy cells, because in that cases you can subside the side effects which are associated with traditional treatment, right? Because it is on a large scale. Chemotherapy has a huge side effect profile that can be eliminated with the precision. Just give me 1 minute, guys. Okay. So we have another future focus area. The very first is the precision. Second is, of course, personalization, where we are integrating artificial intelligence, some of the genomic profile, and that is further helping us to tailor the dose and agent per patient. So I already explained you what is the role of genomic. We already had that course also. Many of you might be having participation in genomic course as well. Those who have attended the genomic course have idea now that genomics are categorizing patients further into that was 3 months of course, right, on a genomics, and we already discussed about 8 to 9 lectures on the genomics. So basically the genomic data gives you the signs and signals that what category a patient has, right, and in what category patient falls, and that gives you idea about the therapy effect. Okay, so person's genetic makeup influence further the drug response basically. So that is again a personalization aspect, right? So you, if you are integrating those things like artificial intelligence, genomic profile, so you can further go for per patient different treatment. It is more targeted. So if you are knowing about that the patient is having CYP26 deficiency, so you cannot prescribe certain drugs which are metabolized by the CYP26 because patient is poor metabolizer in that category. So if still you want to use, your dose will be more as compared to the normal one, right? So that this is how you can make and the treatment very personalized. If the patient is on a rapid metabolizer category, so in that case also you need to adjust dose. And the catch is we don't know from the group of the people who is ultra rapid metabolizer and who is normal metabolizer, right? So that is the importance of genomic actually. And genomic everything apart with the related to genomic started with the very first example, that is real case actually. The mother was prescribed with the codeine drug, right? And the mother is recently delivered a baby, and the baby looks very healthy at first. On a lactation period, 2 3 days later baby died immediately. Now mother has the debilitating postpartum pain, and for pain the codeine was prescribed, which is very normal with every population. But in particularly that case, what happens, mother was ultra rapid metabolizer category, so the codeine was taken with the normal dose intervals, right? Whatever is in the guidelines. And patient was ultra rapid, so the high amount of codeine is converted into morphine in that particular female patient, female mother actually. And that morphine is being transferred to the breast milk to the baby, and baby immediately died. So that's where it is the very first case which was under study, like how it is happening. Then it was banned again, and that was a drug that is under the brand name of Tylenol number 3, if you have any idea about it. Tylenol, right? Codeine it is. And then FD also came up with in 2011 came up with the label also that Tylenol, if you are using in a pregnant woman, it should be restricted, because no one knows until it is genetically testing that what is the patient's category, what is the patient is having enzyme to metabolize drug, is it rapidly, it is normal, it is not normal, etc. That is genomic. Okay, so I hope now you have idea briefly what is genomic. So that is personalization, right? If you are aware of the person's category, you can exactly modify dose accordingly. That's what the meaning of genomics. So we already conducted the course on it, and it is again a very important course to understand in personalized care. Okay, so now imagine if you are going for combination of some of the artificial intelligence, genomic, theranostic principle, everything in one place. So what you will be ending up with, personalization, right? This is our future focus. Also some non invasive, so we are avoiding surgery if there is no need. So we are having some of the nanoparticles in imaging just because of this non-invasive procedure. So imaging guided delivery may be reduced and need for the future surgery and scalable. So the nano platforms, some automation and AI make this theranostic deployable beyond some major centers. So this is our focused area. We are focused towards the precision, personalization, non-invasive and scalable target. Okay, so I hope now this slide is clear. Why I am telling you this, because I hope that one of you maybe have the ignition inside you, and maybe I really want to see you people being further shaping the futures in this particular areas. Because what's the meaning of learning if you cannot make a if you cannot bring a change? So that is the ultimate thing. So you need to understand future focus areas very very carefully, right? Okay, so these are again a timeline for theranostics. So we already understood what is happening through from the 1940s when the use of iodine was inside our treatment chart for thyroid disorders. This is the chart which is more elaborated, right? But I think it is a self-explanatory, and it is more elaborated in way. You can see here the very important thing in the 2020 and 2022 last third one. Okay, so in the period of 2020 2022 we have landmark trials and FDA approved trials vision, right, which leads to the approval of 177LU PSMA 617 for prostate cancer. Very important revolutionary things were there in the 2020 to 2022, right? You don't have to remember the era, but it is just for your understanding, to briefly understand the how the theranostic has evolved till date before jumping into the future. So you can see here vision is there, right? And also 2023 to till present we have a next generation platform emerging. That is nothing but introduction of nanotheranostics, AI driven dosing we are doing, and radio genomics is also there. So I hope now genomic word has inside your mind, right? And you can see here future aspect like by 2030, and then afterwards fully integrated milestone will be there, personalized theranostics will be there. And 2030 is, I think it is only a 5 years from now. Okay, so you can see here कि वहाँ पे क्या होने वाला है. So it will be a integration of artificial intelligence, nanomedicine and genomics, which is leading forward with the precision, remote and non-invasive care. I am very surprised that these terms are not elaborated in our colleges, and it is not because obviously we have a so much long curriculum, and we our teachers are also entitled with so much of duties, right? And they also want to discuss these things, but time constraint and syllabus completion and everything is happening around them. So it is not possible to always discuss these things in the class, because I was also a former assistant professor, right? So but it needs to be there, right? Because theranostic is nowhere explained in the family, and the term is not there. But I hope that in next 1 to 2 years it will be in the curriculum, because it is emerging, right? So those who are attending these sessions are already aware of the term, so I am very happy about it. You can see here the future 2030 has so much of things. Okay, and if you are not aware of AI, if you are not aware about nanomedicine, genomics, that will be no place, right? So it is not in our curriculum, but it is our prime duty to understand it as a healthcare professional, to update ourselves regularly, right? So this is very very important. Of course, I need to tell you that this artificial intelligence, whatever we are learning today, it is not replacing any kind of job. But if you guys are not aware of this, how to use AI and how to use machine learning, that may be the reason behind losing job. So you must know about the softwares which are emerging in the pharma field, the which further leading to the time saving things. So you cannot always go for resources, reference books, okay, every time googling. No, but there are certain softwares which gives you the idea about on a one click. So it is a adjuvant, not a substitution of whatever we theoretically understood till date. So this is the importance of AI and nanomedicine, which is emerging by 2030. So these are the timeline of theranostic evolution. So you just need to understand it was started from iodine, and it is now going on a large scale. See, now the second topic to understand today is the nanoparticle based theranostic platforms. So the definition is clear. It is written as a NPS, that is a nanoparticles. Okay. So this nanotheranostics use engineered nanoparticles. Now engineered meaning a modified. Okay. In some at some level that it can cross everything and go on a target site specifically. Okay, that is engineered nanoparticles, designed, right, modified. And for what? For simultaneous diagnosis, targeted drug delivery and monitoring. So you can use these nanoparticles for three of this. Okay, simultaneous diagnosis purpose, targeted drug delivery, and monitoring itself. So we have a types of nanoparticles, like what kind of nanoparticles are being used in this particular case. So very first we have that is a lipid base, liposomes, okay, which is a biocompatible, very widely used also, right? Second we have a metallic, which is based on the gold. It is written as the GNPS, gold nanoparticles. Okay, and these nanoparticles are further tagged with some isotopes, okay, radioisotopes basically. So the metallic may be in the use, it is a type of nanoparticle, gold or iron oxide, maybe the metal are being used here. And this is very ideal for MRI and PET contrast. Okay. Also, we are having a quantum dots, but quantum dots have some side effect profiles for optical imaging. And also, we have a polymeric nanoparticles as well for the controlled drug release. These are the types of nanoparticles we are having. Very widely used is the liposomes. Okay. So lipid based and metallic is in a wide range of use, and quantum dots are having some of the major side effect profiles, so it is not being widely used. So these are the types of nanoparticles you need to remember. See, this is how it looks like. Types of nanoparticles. Maybe it is having a organic type of particles that contain some liposomes, polymer, or dendrimers. Dendrimers are having so much of branches. Okay. Some of the inorganic like a metal, gold. Or we can also have nanoparticles which are virus-like and self-assembly proteins, VLNP and SAPN. These are some of the examples of nanoparticles. You just need to understand today the types itself, right? And it is nothing like nanoparticles are only used in the only useful in this, therapy purpose of radiopharmaceuticals. It is being used widely in other medicine delivery as well. Okay, so have that broad mind here. It is not associated with only our whatever we have learned till date, the therapy. And this is a nano system. Basically, you can see here some of the metallic, protein, dendrimer, then we have micelles, polymeric, liposomes, and some lipid-based other nanoparticles, which can be used for therapy. On other hand, it can be used for imaging as well. So you can see here the diagram has been, self-explanatory it is. So in therapy, maybe to deliver a chemotherapeutic drugs, to target nucleic acid, peptide or proteins or antibodies, or it can be used for imaging like a fluorescent probes, right? Contrast agent. That is, you can see here, I think it is, I hope it is visible to you guys. The name itself, it is DOTA and DP, the DTPA is been there. So maybe contrast agent, that contrast agents mean it is giving you the illuminant part, right? So it is giving you the signal that some of the metabolic activity is happening, or some quantum dots as well for the imaging. And that's where you have a concept of cancer theranostics. So you are using some of the nanoparticles for delivery is the future. Okay. So again, we have here the mechanism. Just have a look here. Some of the active targeting is happening via the ligands. For example, some of the folate and antibodies, which can be your target, and that can carry both radionuclide plus therapeutic drug. How exactly this thing is happening, the mechanism is written here. So the theranostic effect will be on the image tumor plus to deliver the therapy in the overall one platform only. We have example here, gold nanoparticle. Gold nanoparticle. The example I can give you, that is AUNPS. AUNPS is the one, the name itself, which is a type of gold nanoparticle tagged with the 68GA for PET, like the imaging, plus that doxorubicin delivery. So basically, what it the explanation of this particular sentence, the example is gold nanoparticles tagged with this 68GA which are being used for the PAT imaging, while also it is carrying doxorubicin with it, which is a chemotherapy drug, enabling simultaneous cancer imaging and targeted drug delivery in a single platform. Imagine. Now, imagine this scenario in your head. Like you are inserting something in the body, which is, the nanoparticle tagged with the 68GA. 68GA is used for what? Imaging, right? And also carrying the chemotherapy drug, that is a doxorubicin, all in once. So in PET, you can see that it is traveling, binding with the tumor cell receptors, tagging it, luminescent part you will be having in the PET, and same time it is giving the delivery of the chemotherapy drug. Imagine. So this is something which is lies in future, right? So they are aiming for it, like इसीलिए नैनो पार्टिकल का यूज हो रहा है अभी क्लिनिकल ट्रायल्स में टू चेक दिस वेदर इट इज हैपनिंग और नॉट. अभी क्या हो रहा है? टू ऑफ द थिंग्स आर इन द थेरानोस्टिक्स differently performing. Like imagine it is for by the 68GA dotated, everything is there in PET में आप देख सकते हो. And on the right side we have a therapy with the same target, same chemical dotated with the different isotope 177 lutation. This is what happening in today, right? But this example is saying that you are inserting only one time, which is the gold nanoparticle, which is tagged with 68GA, which is giving you the imaging, which is giving you the metabolic activity location you can see in the pad, and at the same time carrying the chemotherapy agent with it. So imagine the side effect which is having the chemotherapy agent doxorubicin will be subsided, right? There will be no side effect because it is not going with the healthy cells. It is only bounding on the tumor cell. Okay, and doxorubicin delivery means transporting the chemotherapy drug, this particularly doxorubicin, directly to the cancer cell, often using these carriers like nanoparticles to kill the tumors more effectively with very fewer side effects. So I hope now it is clear. Now, मुझे भी बहुत सारे क्वेश्चन हो रहे हैं, like how it is happening, many things are there to understand, but it is in the future, right? So please understand that in that way. Also, we have other example like iron oxide nanoparticle is being used. Now, I hope you have remembering that iron oxide is again a metal type of nanoparticle, which is used in inflammation imaging, plus giving you hyperthermia therapy on the second time. So basically, iron oxide nanoparticles are very good for imaging inflammation via MRI. So they enhance the contrast at the inflamed site. जो भी inflamed site होगी वहाँ पे contrast enhance होगा while using iron oxide nanoparticle. Also, it is very good for hyperthermia therapy, right? So where they are heated using the magnetic fields to kill the disease or cancerous cells very locally. So they have served both purpose in only one thing. Iron oxide nanoparticle is the one which is serving both of the purpose, diagnostic and therapeutic role at the same time. Theranostic example it is. But nanotechnology के साथ है तो term क्या होगी फिर? Nanotheranostics. So this is something additionally what we have understood till date. The word is being there here, nano. Now iron oxide is a type of nanoparticle. So the term here which is used for diagnosis as well as therapy. So the term now justified, nanotheranostics. So I hope it is clear in your mind. The both of the example is very very important. So if someone has question to ask you what is the difference between theranostics and nanotheranostics which is emerging. So now you know the answer. Theranostic deals with the therapy and diagnosis, while nanotheranostics is dealing with the at the very first time the delivery of nanoparticle is happening with the diagnostic agent plus chemotherapeutic drug also. So it is more target oriented, fewer side effect, more personalized, time saving, whatever you can say, the n number of advantages you can list it here for this nanotheranostics. So I hope you have now idea what we are learning today. Let's move forward. So this is quickly and painlessly diagnose and treat the disease. Example is here with the nanopharmaceuticals and sorry the nanotheranostics principles are applied here. So I want you to check this video. Just have a look.
Patients' needs are at the heart of Raman Nanotheranostics. RAND is designed to reduce the need for invasive procedures and surgery.
Just a minute, guys. I think I can limit the.
Patients' needs are at the heart of Raman Nanotheranostics. RAND is designed to reduce needs are at the heart of Raman
See here, we have RA, Nano, and Theranostics, right?
Theranostics. RAND is designed to reduce the need for invasive procedures and surgery to quickly and painlessly diagnose and treat diseases. Safe, injectable nanotechnology is the foundation of the RAND procedure. A single formulation contains a patient-specific dose of gold nanoclusters, which act as internal body doctors for the duration of this non-surgical procedure. Each nanocluster is made of gold nanoparticles, tagged with specific tumor beacons, all held together by a medically safe molecular glue. A tumor-specific targeting system is attached to the outside of each cluster. The tumor beacons and the tumor targeting system work together so that each nanocluster can target, lock onto, and report back on a specific tumor type. Any one injection can be tailored to contain a range of tumor targeting clusters, each with a different tumor beacon, allowing RAND to scan for and treat multiple different diseases in a single test. A patient presenting with a suspected tumor is injected with the gold nanoclusters, which circulate throughout the body, searching for diseased tissue. The tumor targeting system coating the outside of the nanoclusters is designed to sense for and attach to the matching disease markers concentrated on a given tumor's surface. This guides the nanoclusters to the site of disease, where they lock on to their corresponding disease markers and anchor to the tumor cells. RANT achieves faster, non-invasive diagnosis and treatment by scanning the patient using a safe, low-powered laser similar to a supermarket barcode scan that allows light to travel harmlessly into the body. The tumor beacons on each nanocluster respond to this laser scan, sending invisible, scattered light signals back to the detector, exposing the exact depth and location of any tumor targets in the body. The beacons also provide live temperature and pH measurements, and crucially, supply very specific, real-time molecular information, identifying the type and relative size of the diseased tissue. Data is live fed into a computer, providing the clinician with immediate access to statistical advice, allowing for a rapid, highly informed decision on the need for treatment during the scanning session. RAND then achieves targeted treatment by heating up the tumor cells to a specific temperature where controlled cell death occurs. Using the real-time temperature information supplied by the tumor beacons, a clinician safely tunes the intensity of laser light, causing the gold nanoclusters to heat up to this target temperature. Maintaining power for a safe, specified amount of time gradually kills the diseased cells, possibly over several treatment cycles, fully clearing the tumor's tissue. Post-treatment, the nanoclusters disintegrate into smaller nanoparticle fragments, allowing them to be filtered through the kidneys and cleared painlessly from the body in the urine, successfully completing the RAND procedure for the patient.
So this is the future, and I think it is very surprising to see that what is happening in the future, what future lies actually, and if we are not aware of these technologies, at what point we are standing, right? So if you have any question, we can go through it, and then we'll proceed with the next third, which is the role of AI. Will this metal, what it is? It is designed in such a way that it is in a non-toxical nature, right? So we cannot go forward with the chemical moiety and the structure like how exactly it is being designed, but nanoparticles are designed in such a way that it is not causing systemic toxicity. Like it is modified version. As I earlier said, it is completely modified. I think there was a specific word, right? Which was there. It is a design form of the metal itself. Metal is only used for making it sustainable, right? So it is in a very less quantity, and it is designed in such a way that it is not causing any kind of systemic toxicity. Side effect profile is there, but not in that extent. What are the chances that this therapy will completely eliminate the tumors and will not recur in the future? So we have the the transparency of this particular procedure. So we'll discuss in the upcoming slides that what at what extent it can eliminate tumors. So this is not in a right now process, but it is a the session is dedicatedly talking about the future which is happening. Okay, so by 2030 we will be having this kind of technologies in our hand. So this, okay, I can simply redefine this RANT. RANT typically stands for radiotherapy and nanotechnology, or we can say radiation and nanotechnology theranostic combinedly. RA, that is for radiation, NT is a nanotechnology, or you can simply say N is for nanotechnology and T is for theranostics. Okay, so this is how it is defined. Through it's not a widely standardized acronym and may vary by the context itself, but this is a emerging trend, the RNT, right? So it is basically radiotherapy, nanotechnology, theranostics. Okay, are there any active clinical trials going on now? Yes, there are any. We are discussing in upcoming slides, and it will surprise you. After imaging, only we can came to know the dose, right? Then in nanotheranostics, both diagnosis and treatment done. Yes, in nanotheranostics, both can be at a one place only. I hope you are getting the point, right? Is there any confusion over it? The terms are simply defined in the slides and video. It is more clear, like how exactly it's being used, how it exactly it's being targeted, what is inside the molecule. That was a 3D animation, so it is very easy to understand. Dose fixation is the another topic for it, like how exactly it is in the need. So it is in the clinical trials right now. That was exactly the need, having the dose calculation and how we can go and proceed forward with it. We have some of the emerging trials. I will explain you in the upcoming slides. So you will be having idea about brief idea. So I hope it was informative till this slide. Still imaging is done right even after giving theranostic. Imaging is done right even after, yes, nowadays it is being like that, right? Because after theranostics also we need to assess that whether the therapy is being working or not. So we are always going 4 hourly or 24 hourly, maybe in some good cases you can also perform PET, and SPCT also is done for imaging that whether your treatment is efficiently working or not. So we are going with imaging once again. So it is also associated with nanotheranostics. We need to assess everything. But this is what a future lies. So I already gave you the disclaimer that have a broad mind to understand this concept because it is emerging. So it is an endless possibility, right? So basically it is showing us that this might come later or in 2 3 years in our hand, that these are the terminologies, these are the principles, okay, and these are the things which are emerging forward. Okay, so we can move forward with the third topic, which is very important again. Role of AI in the theranostics. Very, very important. Now, please focus on the word. It is a theranostics. Okay, so it is not nano. So, what are the applications you can see here? The first application where the AI has a role is image analysis and interpretation. So whatever we have received in the PET, photon emission, positron emission computed tomography and single photon, whatever we have technique till date, which is giving you the luminescent part with the radio tracer, which is being absorbed by the tumor cells, that needs that is converted into further more precise imaging, so that more precise treatment will takes place, right? So it is covering whatever the we can have we just have the side effect with SPCT and PET. So whatever is not examined through PET, I already explained that every single tissue is being examined in PET, right? But on a very molecular level. So in that case, AI has its role. So it is being in very first application, image analysis and interpretation. So AI in PET and CT scan interpretation, maybe that might give you the emergence of AI in this, maybe giving you the more precise signals. So you can go for early lesion detection with the help of artificial intelligence, and some radiomic pattern recognition as well, which is abnormal, right? So it is also more faster and more we can say the reproducible results it may arise with the help of artificial intelligence. So how it is happening, let me just brief you about. AI is nothing but a large data set. Evidence based data is being inserted into it, integrated into the system worldwide, globally, and they may give you the it may give you the signals on whatever inserted data it has, which is updated on time. So artificial intelligence is nothing like a it is a we can say it is a human made, right? So it is integrated data into the system in a way that it can give you a real time analysis of anything, right? So artificial intelligence for optimization and interpretation of PAT city, it is also the image it been shown here. You can see here the image. So it gives you a more precise idea. On a left side we have the PAT, you can see here the PAT, and on a right side also we have an image of PAT, but with integration of AI into it. So it is zooming you, if you are zooming it, you can see the exact locations you can find out on a very cellular level if the integration is happening, artificial intelligence integration is happening in the imaging analysis. So the interpretation will be more easy. That is the shortest way to understand. What is the summary of the whole slide? Is if you are integrating AI into the imaging analysis, so your interpretation will be more easy and more intense, right? That is the first application. Second application is a treatment planning. So AI may help you, may word is there, please understand. AI may help you to tailor the dose and delivery based on whatever imaging studies has been there, and which is on the patient specific data as well. So imagine if there is a software and you are inserting all of the personal patient's data into the system software, and it gives you the dose calculation for a specific patient in a very short time based on whatever data is integrated globally into the software. So based on that data summary, the hypothesis, the evidence-based data, it is showing you the result that if the patient is having this comorbid condition, if the patient is having this amount of age, if this is the height, if this is the weight, and if this is the body surface area, you may prefer, and if this is the imaging results, you may have this particular treatment at that particular dose for suitable patient. Imaging that. These are the software I am talking about. Please understand, it is not the it is not it is not necessary to completely rely on the AI for dose and delivery, because it is, if in case of the oncology, clinical practice opinions are very very important. These platforms are adjuvant, it is an additional platform with with the plus sign, I can say. So you have to apply your pharmacological therapeutic principles first, and with that you can go forward with this. So if the imagine if the patient is having so much of complexity, and if you can't remember everything at once, then you can go for such software for dose modification and calculation for predicting the appropriate dose, because a human cannot be an encyclopedia, right? So for time saving purpose, AI integration is there. Okay. So here please remember that AI in the healthcare, so it is very risky also, right? We cannot rely 100% on the artificial intelligence for treatment planning. So please understand, it is not the replacement of clinical practices. Okay. So please understand that thing. And also tumor segmentation, where the AI can make a huge role again. Plus it can give you 3D modeling for radiopharmaceutical distribution. So if anything will be in the 3D, it will be very easy to understand and interpret. So at that time, AI has a role. So that is a deploying generative AI in the healthcare, right? It is going for scaling, leveraging a big data, strategic planning and investment, and successful integration is happening with the integration of artificial intelligence. So I hope you now know it can help you with the imaging, it can help you with the treatment planning, and it can help you with the precision dosing as well. Okay, so AI powered dosimetry models are also there. I hope now you know the concept of dosimetry. The yesterday's lecture was all about dosimetry. We also discussed some of the voxel based, right? So AI can help you with this also, right? And also to predict organ toxicity, optimizing therapeutic index. I think we are also using some of the drug to check the drug interaction. The software we are using, right? It is what? It is nothing but the artificial intelligence that giving you the idea, right? Based on whatever data is integrated into the software. Okay, so we have to just include the generic name of the drugs in the prescription, and it gives you the drug-drug interaction possibility. Okay, if the same frequency is there. So obviously other softwares are also there to predict organ toxicity. If you are inserting patients creatinine, serum creatinine, and some of the other parameters and renal function test reports, and asking forward with the, if you are going with the chemotherapy drug or radiopharmaceuticals, that if it is appropriate or not, it gives you a pop-up or alert if it is not suitable. That is what exactly the software does, right? So these three things are there where the AI make a huge role. We have also the examples and tools here. So deep learning for the radiomics is very important. Deep learning radiomics is used to, as its name suggests, for the deep learning of what? The AI models. Okay, like one of the examples we have here is a CNNS, which is a convolutional neural network. So in that case, deep learning is very important. It is a software, right? Okay, AI integrated software to automate what it is does, it what it is doing is to automatically extract some of the complex, very complex features from the medical images. Okay, like the CT scan, MRI, PET, everything, and that are not visible to the human eye. And for better diagnosis, prognosis, and treatment planning, this deep learning is very important tool. So, deep learning is nothing but it combines the artificial intelligence, medical imaging to further uncover some of the hidden parameters for personalized medicine. And it is being underused right now, deep learning. Okay. Also, we have the second tool you can see here, IBM Watson. Now, this IBM Watson is again an AI platform that analyzes further the medical data like imaging, records, and research, and it is further supporting some of the very practical clinical decision making, right? It gives you the idea about treatment, and it is also for personalized treatment. Also, we have some of the Google Health example. Google Health is again a health focused initiative using artificial intelligence and the data, the integrated data, to improve further the healthcare delivery, including tools for disease detection and diagnosis and patient management. So Google Health is giving much things, okay, many things at one place. Also, we have tools like dosimetry check. It is again a software tool used in the radiation therapy to verify and calculate actual radiation dose delivered to the patient. So you can see you don't have to even calculate the dose. You just need to have a software in use, right? So this is for use of and calculating the radiation dose delivered to the patient, ensuring the treatment accurately and the safety as well, right? Also, see here we are having the algorithms also to predicting 177 LU PSMA therapy response. Now I have some work for you. Like I cannot include in a one single lecture the whole IBM Watson, how it is look like, Google Health, but it is a single click away, right, guys? So please open a Google tab, type IBM Watson, whatever first link is there, click on it and check what it is showing. Same goes with the Google Health and dosimetry check. I think if you are curious enough, you will do it. Okay, it is a single click away. We cannot have everything in a 1 hour. So it is just a small exercise for you if you are curious enough to understand. Otherwise, just simply know that these are the softwares, just like what we are using on a daily basis for drug-drug interaction, predicting ADRs. Okay, these are some of our practicals in pharmacotherapeutics. right? So this needs to be understood by us that these are the softwares under use for radiopharmaceutics, right? Deep learning, IBM, Google Health, tools like the dosimetry, check, also algorithms. So these are some of the examples, or you can say tools, software tools. I want you to check this video for better understanding. This is the Laris V with the advanced AI powered application. This is the future, guys. So this will be shortly available. So please understand this video in detail. It will give you the more idea about what future holds. This is the advertisement purpose, but I am not advertising anything here. But you can see here that what it shows. It is a software, guys. See the role of AI here, right? So I hope now you have idea that what future holds, the integration of AI in the softwares. Also, we have this particular video to understand further better in our, the ultrasound technology that what is emerging. So basically, that is the ACUSON. That is a brand for ultrasound imaging system, which is developed by the Siemens Health Engineers, and it provides a high resolution real time imaging which is used in the various clinical areas like cardiology, obstetrician, abdominal, and further the musculoskeletal scans as well. And this per the the term the ACUSON that is for used for advanced ultrasound machines for precise medical imaging, right? So I would like to request you to check this video. I think it is not available. I will provide the link this video, the link of this video to go. It is available on YouTube, so you can go and watch this video after this session. I think इतना तो कर ही सकते हैं हम सब कि 2 मिनट का वीडियो देख ले, right? This is not playing inside the slide, so just give me a minute. I can try if it is happening. Okay, so it cannot show on the video slide presentation. Okay, there might be some legal things with it, but it's okay. But you can, I will share this link and you can just check that how this emerging AI technologies is working in ultrasound to better understand what is programming and how software looks like. This is a very good video actually to understand. Okay, so we can proceed with the next thing. Okay, any question related to this AI? If have any, you can just simply ask. We will move forward with the clinical trials. Could you please share what is one real challenge you faced in Theranostics and how did you solve it? And what all the things we have to be careful about. The challenges are the part of our next slides. So wait for a while. I can share the real example as well by the end of this session. Okay. We just need to complete it. So let's proceed with the very fourth number of learning objectives. And that is nothing but the clinical trials. So one of the question was there in the beginning. What are the clinical trials ongoing and what are, still we have? So the very first is the vision trial with the resistant form of prostate cancer itself. And this is the phase 3 to ho gaya and some of the vision trials are under pipeline as well. So 177 LU PSMA 617 versus standard care in the prostate cancer. We already discussed these things in detail. So it is improving the PFS. Now tell me if you remember the full form of PFS. Anyone? Let me just check in the chat box. Do you know the meaning of PFS? Anyone? I think in yesterday's lecture we have had discussion on this thing in very detail. So I am expecting something from you today. Just you guys are googling. I think no progression what? Yes, progression free survival. Okay, progression free survival, rightly said. I think now you know the meaning of PFS. So, in Vision trial, what was observed? What was the key takeaway from the Vision trial phase 3 of 177 LUPSMA was it was improving the progression free survival time and OS is overall survival time 15.3 versus 11.3 months. 11.3 months was associated with the standard prostate care treatment, the chemotherapy drugs, and some standard of care, and 15.3 months with associated with the R radiopharmaceutical therapy. And this is a landmark for FDA approval in 2022, which is very recent, so you need to understand. Second clinical trial we have for NETTER1, which is again a very important trial for the neuroendocrine tumors. We have 177 LU dotatate versus high dose of octreotide alone, right? Long acting it is, and median for the progression free survival is 28 months. And you can see here alone high dose octreotide long acting 8.5 months only, so it is very big difference. So it is also established in the PRRT, which is a therapy in the neuroendocrine tumors. And we have third clinical trial, which is a therapy capital, and which is a head to head actually. Basically, it is phase 2. Please remember, head 177 LU PSMA 617 versus the trial is versus the cabazitaxel in the form of resistant form of prostate cancer. Better response was identified, fewer side effect, but it is in a phase 2. Okay, so this is head to head phase 2 randomized trial comparing your LU PSMA 617 versus your cabazitaxel chemotherapy in the all men having the resistant form of prostate cancer who had progressed after docetaxel. Okay, so this is again a must read trial therapy. So I have given you the exercise to read about vision and NET TER. Now for today you need to exercise a therapy trial. Okay, please understand that those aspects. Now these are some of the other very important things here, which is a mentionables, right? So we have the compose trial as well. Compose trial is combining immunotherapy and theranostics as well. Also, we have some of the respected ED, which is again a type of PRRT therapy in elderly. The full name is listed here for the respected ED, that is a retrospective evaluation of safety and efficacy of the particular PRRT therapy with Lu-177 dotatate in elderly patient. Everything I think in the previous lectures we already discussed about this PRRT therapy, and you know now what is the dotatate and everything, But I already have the description here. So compose trial जो है, the compose is combining immune therapy and theranostics. The description is written here. So it is again a phase 3 international randomized open label it is and multi-center study it is compose trial. And 177 LU edotriotide, that is the PART therapy, and the versus best standard of care which can goes with the captain everolimus or the Folfox. Now let me tell you what it is one by one. This captain is a chemotherapy combination of two of drugs. If you know, I don't know, many of you might be aware of this term captem, CAPTEM, two chemotherapy drug combination. Okay, capecitabine and temozolomide. Okay, so cap is for capecitabine and TEM is from temozolomide. This is a combination of two chemotherapy drugs, which is used orally to treat advanced form of NATs, and it has shown high response rate like 30-70%. Also, it has a prolonged progression free survival, over often greater than 20 months. And it is also manageable side effects, such as it has only a mild blood count drops and the GI symptoms with the captame. Also, we have the everolimus, that is also a drug and which is used in the anity. And we have a folfox. Folfox is a combination of the chemotherapy regimen which made up of folinic acid, no, again we have a folinic acid combination with fluorouracil and oxaliplatin. Three combination is there. So FOL is stands for folinic acid, then F is stand for another F is stand for fluorouracil, and OX stand for oxaliplatin. The three drug combination is there for flox. It is commonly used to treat colorectal cancer and works by inhibiting cancer cell growth and division itself. So you can see here they are comparing compose trial में क्या compare हो रहा है 177 LU endotriotide which is chemical moiety endotriotide 177 LU is the isotope which is being tagged here. The therapy form is PRRT which is same as 177 LU dotatate, and they are comparing this with the standard care just like the combination of chemotherapy agents, whether it is captame, folflox, or alone it is the everolimus in patient with well differentiated aggressive grade 2 to 3 type of entities which is specifically a gap, that is that is a gastroenteropancreatic neuroendocrine tumors. So you can imagine the level of composed trial. Only one agent which is in a comparison with a standard care space. It is under it is under the phasing, and it is not yet we are having any kind of result with compose. But you can read at the some of the websites, you will have the articles related to the compose trial. And also we have respect ed under pipeline, which is a retrospective multi-center study again, and it is for just a minute guys. Okay, so it is on assessing the safety, tolerability, and effectiveness of our own 177 ludotatate, which is a ludathera, right? PART, again PRRT, which is a treatment approach in elderly patient over 70 years of age is the inclusion, and with the NATs. So you can see here the clinical relevance supporting offering this therapy to older NAD patients after individual risk benefit assessment. Also, it encourages more inclusive treatment decisions in geriatric oncology and nuclear medicine. This is where we are standing with Compose and Respect ED. Okay, these two are under pipeline, needs to be studied by you. Okay, after Vision, NADTER, and Therapy, P capital. Apart from that, three, we have this two to understand. Okay, so this is clear. Now, the fifth part and the last part to discuss is expanding theranostic beyond oncology. But let me just uh, have your questions if you have any with any of the treatment we can increase the progression free survival and overall survival, and we cannot completely get rid of the cancer. I cannot get your question. Any with any of the treatment we can increase, we have different progression free survival with different treatments. Overall survival rate is also different with every therapy, but right now radiopharmaceuticals are on a top. You can see here radiopharmaceuticals are in comparison with the standard care, right? 2 3 chemotherapy drugs which are standard till date. So radiopharmaceutical one single agent is being compared with the standard care and they are beating it, right? It is beating, right? So basically, that needs to be understood by you. Okay, so we can proceed with the fifth number, which is expanding theranostics beyond oncology. Most favorite topic of us since very first lecture. I had that question in the chat box that what is the role of theranostics, beside oncology. So very first in the inflammation and infection, we'll see because it is the very commonest radio labeled WBC or any kind of FDG PET. Now I hope you remember, but let me just remind you that FDG stands for fluorodeoxyglucose. Okay, and the this technique FDG PET is a fluorodeoxyglucose positron emission tomography, where this component is mimicking like the glucose, and the glucose moiety is being absorbed by the tumor cells. Okay, high in uptake. So it is used already right? Nanotheranostics to deliver anti-inflammatories plus visualize the inflammation things. This is the role of theranostics in inflammation category. So we can check inflammation, okay, by using certain things. In the card, we have a elaborative description of each of this category. Do not worry. This is only overview slide. Okay. Also, we have role of theranostics in cardiovascular. In that case, we can go for certain kind of imaging atherosclerotic plaque inflammation with the help of 18F 18 fluorosil. You, I hope you have the name clear in your mind, which is the NAFPET, which is the full form here, that is a fluoride PET scan using fluorine 18 label sodium fluoride. Okay, NAF, fluorine 18 labeled sodium fluoride, okay, to detect further the bone activity and the abnormalities, especially for the bone metastasis in cancer patients, right? So that needs to be checked by the 18F NFE, which is being used in the bone metastasis check, but it is also useful in imaging atherosclerotic plaque, and it is providing a high resolution images further. So this nanoparticles for targeted drug delivery, you can go for like a statin release. Okay, so this is the future use and the theranostics beyond oncology. Also, we have a neurology like in Alzheimer, theranostic ligands for amyloid beta imaging and targeting may be used. If you know, the main cause behind Alzheimer is the two causes are there. Three actually, I can say. One is amyloid plaque formation. Second is tau protein. I think if you remember the pathophysiology, tau is a protein in the CNS which is, acting like supplying nutrition and which is getting triggered in the Alzheimer. Okay, so we have a tau protein mechanism, amyloid plaque formation, and also genetic influences there in Alzheimer case. Three causes are there. So in theranostic ligands, we can go and target the amyloid beta things, right? So we can have a imaging with it, we can target it. So in that case also we can go for it. But let me tell you, it is we can say it is the study are under pipeline. We don't have anything for neurology. Okay. Also for stroke, this is the simple idea. Also for stroke, like imaging ischemic imaging further ischemic some of the this nubra, that is referring to the area of brain tissues at a risk during a stroke, right? So it is ultimately damaged, but still it is a, we can say, salvageable if it is treated quickly. It is manageable. Neuroprotective delivery, that means giving the drugs often via targeted methods like the nanoparticles to protect or rescue your brain cells in particularly this particular zone, okay, and reduce the brain damage. So in short, there's a nubra, that is the brain tissue in the danger. Neuroprotective delivery may be achieved with the help of this theranostic principles or nanotheranostic principles. So these are the things. Let's brief you about these three in detail. So we'll see the very first thing, that is the inflammation and infection. So current application we have. So we have already radio labeled white blood cells or 18F-FDG. I'm not repeating again everything, the full forms. I hope now you have idea what is 18F-FDG. So we have a radio labeled WBC and or 18F-FDG PET are already used to detect the infection and inflammation in severe cases. Okay, for example, osteomyelitis or abscesses. So FDG, that is a fluorodeoxyglucose, that is highlights further the area with increased glucose uptake, which occurs in the activated immune cells as well, just like the tumor cells. Okay, so in that case it is under used. What is the future approach of nanotheranostics, in particular inflammation and infection? So nanoparticles can be designed to visualize inflammation as well using targeted tracers like VCAM1. Now what is this? This is VCAM1 stands for vascular cell adhesion molecule 1. If you are noted down, if you can, VCAM stands for vascular cell adhesion molecule 1, or you may use some of the integrins further, which is a future approach to visualize inflammation and the areas of inflammation in severe cases. Also, you can see this VCAM is nothing but a protein which is expressed on the blood vessel, okay, blood vessel walls during inflammation. I hope you have the idea. Vascular cell adhesion molecule 1 is a protein expressed on blood vessel wall during inflammation, helping your, WBC cells to stick and move into the tissues. So it is often used as a biomarker in inflammation and cardiovascular diseases, right? So this is the case. Also, it future approach hold delivery of anti-inflammatory drugs like corticosteroid and NSAIDs to directly to inflamed tissue. So अभी तक तो हम पढ़ रहे थे द साइड इफेक्ट्स ऑफ कॉर्टिकोस्टेरॉइड्स एंड वाइवा में बहुत बार पूछा जाता है फेवरेट क्वेश्चन ऑफ टीचर्स व्हाट आर द साइड इफेक्ट्स ऑफ कॉर्टिकोस्टेरॉइड्स. So there those side effects can be eliminated by this technique, right, if it is more target oriented. So this can be achieved by the nanotheranostics. Example, we can go for some of the gold or liposomal type of nanoparticles loaded with dexamethasone type of corticosteroid, which is guided by MRI and PET. So just you can imagine the future approach. It is in the future. I hope you have many questions, but please have broad mindset that if this is the principles coming in the therapy regimen, it may be the option for above oncology. The nanotheranostic use is this in the particularly inflammation and infection. Let's have a look for cardiovascular disease. So theranostic imaging can be used for plaque detection like 18F, NAF. I already explained you the full form of NAF. Sodium related, right? PET CT that can visualize some of the vulnerable atherosclerotic plaques, indicating risk of rupture and heart attack and stroke. So it can actually detect some of the microcalcification activity, a marker of unstable plaque. So we can go and target it. And we can have a targeted therapy with the nanoparticles. Nanocarriers can be engineered to target inflamed and oxidized endothelium in the cardiovascular system, and it is delivering further the targeted therapy with whether it is statins, antithrombotics, or even some of the gene editing tools to specify atrial lesions. Those can be some of the beyond oncology aspect of nanotheranostics. Example, we are having HDL mimicking nanoparticles. So nanoparticles which are mimicking exactly like the high density lipoproteins, right? And delivering further statins directly to the plaque area, improving further safety and efficacy, right? So this is a future perspective. And in the neurology, let's see what is happening. So theranostic ligands should be there. For example, 18F, the floor beta pair, right? The image amyloid beta plaques. So they can have a image of amyloid beta plaques in the Alzheimer. So future goal is to use, if you have idea, we don't have any treatment for Alzheimer, we are only having a symptomatic care, right? And some of the agent may be regulating some other pathways in the CNS to make everything balanced, but we don't have ideal treatment of Alzheimer, and we also have very less cure rate of Alzheimer as well. Okay, so this will be the very good approach and research area to go forward with. So using nanoparticles that binds to the amyloid plus delivering any kind of anti-amyloid drug or any kind of SIR, the siRNA for targeted disruption. Maybe the future holds. For stroke also, theranostic imaging helps to visualize some of the ischemic neural area, which are the tissues at the high risk, but it is manageable and salvageable. So nano agents could carry some of the neuroprotective agents like this NRF2 activators and further reduce secondary damage post stroke as well, which is the oxidative stress. So this will be the revolutionary thing in the Alzheimer and stroke. Let me tell you, this will bring you a any kind of, this is a very revolutionary thing actually, and this will solve many problems associated with the Alzheimer and stroke. So, what future promises is a gene delivery? Now, this is another term, and this is another thing to understand that gene delivery also may be possible with the nanotheranostics. So, these nanotheranostics vehicles may also carry some of the CRISPR and the Cas9 gene, mRNA, some of the selected mRNA, or if you know, this CRISPR is nothing but a gene editing technique, right, which is being underused. But with the help of nanotheranostics, you can actually deliver gene, right, or some of the this siRNA to further modulate some of the disease genes locally. So अब जब जहाँ पे हम लोग every time we used to write the cause is being asked genetic cause. So in that particular cases where the exact cause is genetic, you can target modification treatments which are associated with nanotheranostics. This is future promise. Also in immune therapy, nano-based theranostics may allow further targeted delivery of cytokine blockers. For example, interleukin 6, TNF alpha in some autoimmune diseases. So it is beyond oncology, right? We have specifically for neuro, cardio, inflammation, infection. But apart from that, whatever disease has a genetic cause inside it, you may target that therapy. Also, some of the autoimmune diseases like rheumatoid arthritis, you can directly deliver cytokine blockers in that particular cases. Also, this is another thing, RNA based platforms maybe the future holds. Use of RNA, the aptamers for targeting, imaging, silencing the gene expression in the real very time. So this is what the future promise about, every aspect. Now I don't think so any of the major system is left behind which does not include the nanotheranostics in it. We have cardio, neuro, infection, inflammation. So when I say infection, inflammation, huge categories being covered, right? The treatment and treatment approach of the particular disease. जो बच गया था वो भी आ गया इधर. The every disease that has caused genetic, which is being treated by it, autoimmune condition can be treated by it. Whatever the RNA based platforms may have the role in the nanotheranostics. That is what the future promise looks like. And also very important topic is challenges ahead, miscellaneous topic, but I think by understanding of this much of concept in detail, now challenges are very easy to understand. Obviously we have access, first challenge, like limited to urban and tertiary centers. Affordability, that is a cost. These are very expensive agents, 177Lu, right? Lutetium, PSMA ligands like a process specific membrane antigen, and some of the nanoparticles are also very costly. Regulatory issues, nanotech regulations unclear in many regions. Training needs, so obviously need for nuclear medicine plus molecular biology expertise is very important. So you guys can start training on this. By 2030, you will get a good amount of payable job in this particular field if it is emerging, right? So training should be very first, and also infrastructure. Like it requires hybrid imaging, very hot labs, and AI tools should be there. So these are some of the challenges in the setting, but we can overcome these challenges, right? So, what are the points to take home, guys? Nanotheranostics is a next frontier. Multifunctional it is, precise it is, and minimally invasive it is. Also, artificial intelligence is transforming imaging, planning, and personalized dosing. Clinical trials are there to validate the safety, effectiveness, just for example, vision, NETTER, therapy. Apart from that, we have compose, right? And also we have that respect ED. Theranostic is expanding to the non-oncological conditions. For example, you have now the neuro, cardio, autoimmune, infection, inflammation, okay, genetic causes, the gene basically gene cause disease conditions. Also, we have barriers that includes cost, access, training, but future is promising. So that is the points to take home for today. And we are ending the session as well as the series of Theranostics. I hope it ignites your mind at some level, right? Okay, let me just give you the progression. Okay. Can Theranostics be applied for Parkinson disease as well? Of course, it can target the Parkinson, exactly the root causes behind the dopamine, right? Dopamine deprivation. So, levodopa is the drug ideal for the Parkinson, but we can more be targeted with the nanoparticles if we are focusing towards neurology. But let me tell you, it is not as easy because when it comes to the CNS area, we need to be very precise even in the nanoparticle delivery, right? Can you please specify any HDL mimicking nanoparticles? So, see, this is under pipeline right now, but we have examples of HDL mimicking nanoparticles. So, I can give you the examples also. We have some of the chemical moieties, okay, that can deliver and bind exactly on the target. So we have some of the delivery drugs or imaging agents to specify the tissue like the tumors and inflamed vessels, and that can actually bind to the cholesterol receptors, just like the SRB1, right? So yes, the exact examples we don't have right now the name itself that is mimicking the nanoparticle which is mimicking HDL, but nanoparticle is a base compound, right? We need to modify the chemical moiety accordingly. We need to tag it, and then it can mimic like the same compound. Okay. Can it be applied for rheumatoid arthritis? How? RA, right? So I already explained you that the principle can be applied to autoimmune conditions. okay, to modulate the immunity. It is under pipeline, which we are not sure enough that it is for the for RA, it is a suitable treatment right now. uh, can CAR T cells be used with theranostic agent in cancer treatment, like using radio label tracer for both tracking and therapy? Is this being done in current research? So, if you are aware of CAR T is the gene in, the modify the basically what is CAR T is taking tissue from the human, like a body, and then modifying the genetic makeup in expected way. Okay, gene editing is performed, and then back it is the inserted back into the human body. That is what the CAR T means. And this cells be used in theranostic agent in cancer treatment. It is under use, like CAR T is there in the use, and this is very prominent technique, right? But if you're talking about radio label, there is no such examples right now. Okay, CAR T is the chimeric antigen receptor T cells, receptor T cell therapy, right? And this is being widely used. We cannot continue tomorrow for sorry, but we are having a last lecture today. I am also having a great time with all of you. Actually, I am very grateful that you guys are interested in learning theranostics, right? So I also want to end the session with some of the some message. So okay, we have reached the end of our journey, and it's hard to believe like how how much we have covered in just 6 sessions, starting from the basics of theranostic to exploring advanced application of AI and nanotechnology, which is the part of the today's discussion. So thank you guys for staying engaged, asking such a great questions, and bringing such enthusiasm to every session. And whether you are walking away more curious, more inspired, or just a little more confident in this field, this learning doesn't stop here. Keep exploring, keep questioning, and most importantly, keep imaging what's possible. And thank you guys for here. Like I can imagine that one maybe of you might be shaping future ahead in the theranostics. Okay guys, the important announcement here is you are having a test on Tuesday. You guys are having test on Tuesday. Link will be shared with you in the group. And I hope to see you guys in future courses as well. Okay, and I am also eager to see your feedbacks. Okay, attendance form will, I think it is there in the group. Okay, I hope to see you guys in the future courses as well. I think many of you might be attending today, attended actually the conference we held today, and we are also coming up with the de-prescribing course. Okay, from the 10th, no, 16th of July. Yes, it will be MCQ type, very short and understandable question will be there. Okay, 10 to 15 questions will be there, and you need to pass it with the minimum criteria in order to get the certificate. Okay, so I will be very happy if maybe a few of you will be the ones contributing to the those breakthroughs or the challenges we already learned in the theranostics. Come up with the solutions, guys. Come up with the solutions. What can be done in the research? What can be the new things, right? What can we do the wonders in this particular theranostics and nanotheranostics? I would love to discuss about it. Still, see if it is missed by any chance, like whatever sessions if you missed, the recording will be provided to you. So in the by Sunday and Monday you can check it out, and then you can appear Tuesday. That's the only reason we have kept the test on Tuesday evening, so that you can check the recordings and then appear with the for the test. Thank you. I am appreciating your comments, good comments. Also, I would like to tell you that it was the very first time in India the short course on theranostic was launched, and we have a great response.